time we have today, we are going to keep everybody muted and ask that you send your questions through the chat function. And we will take those when we get to the Q&A portion. And thanks to those who sent questions in advance as well. So I'm Jill Lalonde. I'm the Executive Director at OneVillage Partners, and I will let my colleague Chad introduce himself.
Hi, I'm Chad. I'm the Program Director here in Sierra Leone.
Great, thank you. And so today we're gonna, again, just go through really quickly situation update and what's going on in Sierra Leone. I know that's why a lot of you are here today. I'm going to share some really high-level updates on our strategic progress, and then talk about our programs in Sierra Leone and what we're doing to get up to speed and also respond to COVID in real time. And then I'm hoping to spend about 15-20 minutes on the presentation piece so we can have time for Q&A at the end. So in Sierra Leone, as of today, there are about 1,700 cases and about 66 deaths. And again, these are confirmed cases. So as we know around the world that the actual numbers are probably much higher than that. There are 13 ventilators in the country. So our focus has continued to be on prevention as a really key aspect of our response, given the limited treatment opportunities for people who do get sick. I'm very happy to report that we have no active cases in our partner communities, and no one among our staff, community partners, volunteers in Sierra Leone has been personally affected by COVID, as far as we know. So we're crossing our fingers that that continues. So good news so far on that side. And, this continues to be a health and perhaps more importantly, an economic crisis in Sierra Leone. With the hungry season and food prices rising, food security is going to continue to be a major challenge and also a big focus of our response as we're working with communities to determine what they most need to get through this crisis. And so just really briefly on a strategy update, I'm going to save the programs piece for Chad, and he'll go into that in a bit more detail. But I'm going to run through the other three goals really quickly to show what areas we've been able to move forward this year, and then other areas that are behind, and some that have changed slightly. So in terms of raising our public presence, I'm so excited that we have a new website rolling out next week. This is actually happening sooner than expected. We've had more time without in-person convenience to get this off the ground. So thank you to our fabulous team here and Sarah for leading this up. Watch your inboxes next week. We have some new partnerships in Sierra Leone, which are really exciting. We are collaborating with Save the Children to coordinate the NGO response in our home district. And we had a new partnership with Water4 to install a well, amongst some others. So I guess silver lining on some of the crisis is it has created some new opportunities. And including in Minnesota in the US, we have a new partnership with the Sierra Leone community of Minnesota. And we had a really successful donation drive where we raised more than $2,000 in-kind food and household item contributions and another more than $3,000 in cash contributions. So we were able to reach over 200 families in the Twin Cities who have been impacted by the COVID crisis and by the rioting and damage caused after George Floyd's murder in the cities. We are going to be rolling out a tutoring program with the Sierra Leone community of Minnesota. So if you're interested in being a tutor, and we'll have options for remote tutoring, we'd love to hear from you. So please let me know. On increasing revenue, we are not able to have any in-person gatherings, and it's going to continue to be a challenging fundraising year for nonprofits overall. And we're really grateful that our supporters are very loyal, but we know that the economy is really being hit hard right now. So we launched an emergency campaign with the goal of raising $300,000 by the end of August. And these funds are really necessary for us to continue responding to the pandemic and to the economic needs in Sierra Leone, and to get back to as normal operations as possible as we keep ramping up, as Chad will tell you more about. We're very excited to take our events online, and we are hosting our first ever virtual happy hour event, Cheers to 10 Years, on September 24th. And that will be an option to participate virtually or to attend small gatherings of people in their homes for those who are comfortable hosting small groups. So more on that soon as well, and mark your calendars for September 24th. And finally, and then I'll pass it over to Chad, growing our organizational capacity has also been something we've been able to invest in this very, very strange year, and dedicate some more time in some really important areas that are maybe less exciting than programming, but very essential to operating our business. We rolled out a new CRM tool called Razor's Edge. If anyone knows of it, it's fantastic. It's been really fun to get that fully up and running and get that done quickly. On governance, again, I'll spare you the details because I know that's not why you came to this coffee break, but we've been able to make a ton of improvements, rolling out new bylaws, committee structures, policies and procedures that will help our organization continue to be efficient and effective as we grow. And we've also been really intentional about our board recruitment and added some fantastic new board members with really targeting certain skills and expertise. And our priority for the past year or so has been adding more Sierra Leoneans to our board, being really intentional to find people that can lend their contextual expertise to continue to advance equity and diversity within our organization and ensure a really strong connection between the governance in the US and what's happening on the ground in Sierra Leone. So the partnership with the Sierra Leone community of Minnesota is really important for this piece and helping us to really build a fantastic board pipeline. So Chad, over to you.
Great. Like many of you, we started out 2020 with ambitious goals, lots of plans, and then everything changed. So we've actually been a lot luckier in being able to push things forward, more so than we thought when we checked in with you guys in our last town hall. We've opened up our new office in Daru, which is a community a little bit further down from Bunubu. And we intended to expand geographically from this and go into new partner communities. We've had to slow some of that down, but we've still been able to open up the office and get started building strong relationships there. In the meantime, our pilot lead program that we started last year has continued throughout the year. This is the program where communities are able to write a proposal that we then fund. We've been really excited by the progress in this, and it doesn't seem like things have slowed down very much at all. Moving on to the rest of our normal programming for the year. All of our staff are back in Bunubu. You can see some of them on camera now, and you've seen some of the pictures. We're trying to adapt to the new normal, and so that means lots of social distancing, wearing a mask inside the office, and trying to figure out how we can take meetings remote when we can. In terms of our projects, though, one of the big values of being a community-led organization is that we're not required to be front and center at all of these projects, that a lot of them have their own kind of momentum. And that's been really encouraging to see as we've been locked down and had to step back a little bit from our active role inside the communities. So major projects have continued on, including the very important secondary school project that's going on in Lalihun. And as Jill mentioned before, we also have the Water for collaboration with the Maka community to complete the clinic there, where we were able to dig a borehole well last year with them. We're rolling out our trainings, including our annual evaluation exercise, the most significant change. Every time we do so, though, we ensure that there's an environment where it's spacious, where we can socially distance, and we also provide masks. We've provided almost 800 masks so far, and it looks like we're just going to keep doing that as well. Like I mentioned before, we are continuing on with the lead projects in Grima, that is the expansion of the maternal health clinic, and in Mambama, that's the electrification of the youth skills training center there. Both projects are moving forward, but as I said, we're probably going to have to look at our schedule and figure out how we start the next round of lead trainings. But it's been very good for us still to refresh and to really look at refining that program. And we have also restarted our Now financial literacy training, and it's been really key for us to maintain good connections with all of these women, because as you know, women are really the financial backbone of households and also whole communities. So as we see this kind of slow building economic effects as they start to impact some of the rural communities, it's really important that we remain in constant conversation with these women moving forward. And then if we move on to our COVID response activities, we continue to work with the Ministry of Health in providing food for quarantined persons, and then also providing fuel for contact tracers to reach some of the more remote areas. We have also continued to do our support of the chiefdom task forces. And like I said, a chiefdom is like a geographical area, probably similar to a county. And in that area, what we're doing is we're providing training, but also training on how to train others in COVID awareness and sensitization. One of the things that we've also been really excited about is this is a very self-sustained activity. This was something that we didn't impose. This was a request that came from Paramount Chiefs and to help us support this. So they've had some success in kind of isolating some cases as that may have turned into a much bigger problem in some communities. We're also supporting them by providing, basically we're paying for their phone bills so that they can share information and learning among the 200 task force volunteers across our operational area. The next big project that we're doing is the Nixon Memorial Hospital project, where we're working with a building to rehabilitate it and turn it into a quarantine center. Right now, the decentralized quarantine approach hasn't really worked out as well in Kailaun district. And so what we're hoping is that by centralizing a quarantine area so that people who've been primary or secondary contacts can stay there for 14 days, it will mean that they'll be able to access care immediately if they do develop symptoms later on. So we've taken the first lead and made the rehabilitations in terms of making sure that piped water is going into the building, and as well that the sanitation system works well. And our real goal for this is to have a very dignified space for people to quarantine as this pandemic continues on. And then finally, as Jill mentioned, we've been tasked with assisting in the coordination of all the NGO activities in Kailaun district, along with Save the Children. And this has been really great because it's really an opportunity for us to push forward, not just our own kind of disciplined approach as we try to catalog all the different activities and make sure no one's duplicating efforts in certain areas, but also to really push forward some of the things that mean a lot to us, like our values of being community-led and really sharing our much more participatory approach with other NGOs. And like Jill said, this is an opportunity for us to kind of like punch above our weight, but also maintain our community-led focus. It's been really exciting and rewarding for me to see how even as we're operating on a larger scale outside of just our operational communities, working on regional projects and with larger international NGOs and government entities, we've maintained our community-led focus. Initially with the Nixon Hospital project, the Government Emergency Response Center and the hospital approached us for this project and thought that would be that. But we said, no, we're not going to engage in this until there's a much more of a community consultation and we get their full buy-in as well. And that was respected, and the community has really been a real big supporter of this project moving forward. I think also one of the things that's been exciting too is the other organizations and the government have seen how we've put a lot more trust in our local volunteers to affect the behavior changes in their own community. And these are behavior changes that can really protect communities and isolate communities from this pandemic. And that approach is being noticed, and we've been asked by the Emergency Response Department of the Ministry of Health to explore ideas about spreading this task force volunteer approach to the rest of the district. And just to remind everyone, in case I'm throwing over too many words, a district is basically kind of like a geographical area akin to a state or something like that. So this is a big opportunity. And then finally, like I mentioned too, we want to make sure that we're still bringing the same disciplined and data-driven approach to measuring our impact with our partners and collaborations with the other NGOs. So that's about it for me out here.
Thanks, Chad. A few quick calls to action. I hope you'll share our posts on social media. If you're interested in being part of the tutoring partnership with the Sierra Leone community of Minnesota, please let me know and we can get you more information. That'll be launching in the coming weeks. If you are in a position to give right now or pay your pledge earlier than we usually ask, which is in the fall and in the winter, we'd really appreciate it. It makes a big difference in being able to continue our work, continue our COVID response. And finally, we hope you'll join us for our Cheers to 10 Years event on September 24th, and consider hosting a watch party. You can do that either in person if it's something you're comfortable with, or you can do that virtually and bring together your network beyond your immediate geography to get together and support a cause that you care about. So thank you everybody so much. We'll shift to Q&A. And thanks to those who sent in questions in advance. Just a reminder, if you have a question, please put it in the chat function. And I'll start with a couple of the questions that were sent in advance, which are mostly for Chad. So Chad, question from Yoki. After COVID, do we have any plans on how we're gonna work with those who survived the COVID pandemic in our partner communities? What might that look like with survivors?
We're not quite sure about that yet. I think that's definitely something to think about, especially as the science comes in about how even if people have very mild symptoms of COVID, oftentimes there's some chronic ailments that follow up with that. I think overall, probably what we're really going to be focusing on is making sure that we continue to build up the health and well-being of the communities that we work in through our community action group volunteers. But I mean, it's been a very dynamic few months out here, so we're kind of adapting to things as they come. So there could be there could be something around that later on down the road too. But just as a reminder, no one has been affected with COVID among the over 26,000 people that we support currently.
Chad, we had a few questions about food security, and can you talk a little bit both about how our community partners as well as how OVP is responding to the hungry season and the food security crisis?
Well, I think the first thing to note is that communities in Sierra Leone are not, the hungry season might be something that happens annually, but it's not something that people are passive about. I think it's important to remember that there's a lot of initiatives and a lot of solidarity in the rural communities that we work with in terms of helping people get through food insecurity. A lot of our projects in the last few years have been focused primarily on agriculture, on developing more efficient agricultural practices and measuring yields, and also looking at, we've developed lots of seed banks where people can kind of get a loan for additional agricultural inputs. So that's some of the ongoing stuff that we're doing. But really right now, one of the key things that we can be doing is paying attention to the situation as it's happening in the communities, really engaging, particularly like I mentioned, with women in our communities through our NOW program, and also with our volunteers through the community action program too. I think this is something that we're all very aware of, but we want to make sure that we're in dialogue with community members. I think overall in the country, with the lockdown has been lifted as of almost a month ago. So I think we're going to see an easier movement of goods and services back and forth. Hopefully this will be enough to kickstart some of the economic activity that might slow down at least some of the economic impacts of COVID.
Great, thanks, Chad. Does Sierra Leone have a chance of containing the spread of COVID?
I don't know. I think they've actually, there's been a number of very good articles out there about how people kind of have anticipated that COVID would spread in sub-Saharan Africa in a very disastrous kind of way. And a lot of that alarmist kind of attitude didn't come about because actually health infrastructure and, you know, the ability for community members to come together in solidarity and do something about this. This is something that, I mean, for many people in our communities, this is their second major pandemic. And I think a lot of behaviors are already adapted. And I think the government response was very proactive as well. So there aren't too many active cases right now. I think we're still very lucky that predominantly a lot of these cases are being traced. Predominantly they're in urban areas. I think the difficulty is going to be if there's some unchecked spread when it gets to rural communities as well. And that really hasn't quite happened yet. And I think if we can continue to really push proactive measures and, you know, through mask wearing, social distancing, and really pushing a local response to this, we can really see at least more rural communities protected from COVID moving forward. But yes, I don't know if anyone has control of COVID-19 right now.
So Chad, we mentioned that we haven't had any confirmed cases among community partners and staff, which is fantastic, but can you speak a little bit more to how people are feeling in Sierra Leone?
Yeah, I mean, I've got all, like many of our staff are listening in right now, and it would be great to hear them. I think we have tremendous staff in Sierra Leone who even before there was a state of emergency, even before there was any COVID cases in the country or even in surrounding countries, we were educating community members, we were sensitizing community members, we were trying to be a good well-being role model to community members out there as well. And I think the fact that we've been able to take initiative has been really good. I think in the early days, people kind of expected something similar to the Ebola outbreak, and that hasn't happened. So in many ways, a lot of your average person on the street might be downplaying it a little bit, but I still think that it's, you still see hand washing stations outside of major shops and major buildings, people wearing masks. You still see people kind of engaging with COVID, and also starting to push back in a little bit of the misinformation that happens right now also. I think in the early days, there was a lot of misinformation that went around, and you know, everyone is kind of taking it as their own duty to make sure that we're pushing back against that information, whether it's online or in person.
And what has been the most exciting thing of staff getting back to Boonamboo and getting back to work in more normal operations?
Yeah, I mean, I'm sure the answer is many people have answers for that individually. Honestly, you know, when we locked down, we kind of sent everyone home and we didn't know what the next step was. And we've tried to kind of, you know, feel our way through this pandemic. But that first staff meeting where we were all back together, it was a little strange because we were all wearing masks and separated out further. But to me, it was just really encouraging to see everyone in person again. And the morale is high. I mean, we have less time to complete a lot of our annual targets, but everyone's been really rolling up their sleeves, and I'm quite proud of the work that we've been able to do so far. Is that correct? Have I misinterpreted anything? People on Kate's computer, can you just give me a thumbs up if I'm correct or not? Am I correct? Yes. Okay, great, great. I got a thumbs up from them. Okay, good. I don't want to mischaracterize them.
Great. Well, no other questions right now.
Great.
So thank you, everybody, so much for attending. Thanks for your interest and continued support. We'd love to hear from you, so please reach out, send any questions that come up after this our way, and we hope to be doing more of these convening, so we hope to see you again. Thank you.
All right. Thank you, everybody.